Assalamu alaikum warahmatullahi wabarakatuh. Today we are going to discuss tuberculosis. TB is a bacterial infection caused by mycobacterium tuberculosis. It primarily affects the lungs, but it can also affect other parts of the body such as lymph nodes, bones and joints. TB is spread through the air when an infected person speaks, coughs and sneezes and a person nearby inhales the bacteria. Symptoms of TB in the lungs includes a persistent cough, chest pain and coughing up blood. Other possible symptoms include fever, night sweats, weight loss and fatigue. TB can be treated with a combination of antibiotics, but it can take several months to complete the treatment. TB can be latent, meaning that a person is infected with the bacteria but doesn't have any symptoms at all and is not contagious. LTB can become active TB if the immune system becomes weakened, for example due to HIV infection or other condition that compromise the immune system. It is important to get tested and treated for TB if you have been exposed to the bacteria or have symptoms. Without treatment, TB can be fatal. There are several tests that can be used to diagnose tuberculosis. First one is TB skin test or TST. This test involves injecting a small amount of fluid called tuberculin under the skin of the lower arm. After 48 to 72 hours, the person's skin is examined for a reaction. If the skin is raised, red and swollen, it may be a positive reaction indicating a possible TB infection. TB blood test. This test looks for antibodies to the TB bacteria in a sample of the person's blood. If the blood test is positive, it means the person's immune system has responded to a TB infection. Sputum culture. This test involves collecting a sample of the person's phlegm, sputum and sending it to the laboratory to see if it contains TB bacteria. Chest X-ray. This test can show if there are any abnormalities in the lungs, such as scarring or areas of inflammation, which could be caused by TB or fibrosis. Bronchoscopy. This test involves inserting a thin flexible tube is used to collect a sample of tissue or fluid which can be tested for TB bacteria. A combination of tests is usually used to diagnose TB as no single test is completely reliable. It is important to get a proper diagnosis and treatment for TB as it can be serious and potentially life-threatening infection. Thank you for watching my channel. Allah Hafiz.